Good evening, everyone. Bonsoir, Kwe. Thank you all for being here. I want to begin today's meeting by taking a moment to reflect on and to acknowledge that the space we occupy today is on the unceded traditional territory of the Algonquin and Anishinaabe people who lived and continue to live on this land. I would also like to recognize and honor the valuable contributions of the First Nations, Inuit, and Métis people who call this land their home. When we acknowledge the land, we remember unceded means that First Nations people never ceded or legally signed away their lands to the Crown or to Canada. When we speak of traditional territory, we speak of land they or their ancestors traditionally occupied and used. This land sustained them, and as stewards, they cared for the land and the waters that flowed through them for generations before their lives were irrevocably changed through colonization and forced assimilation through the residential school system. In the spirit of true reconciliation, as chair of the Board of Health, I pledge to complete the Foundation of Indigenous Cultural Safety course to ensure they understand and respect Indigenous histories, cultures, and health perspectives. This training will aim to improve the quality of care provided to Indigenous populations and foster a more inclusive and respectful healthcare environment. And I commit to continuing to enhance our partnerships with local Indigenous communities to co-develop health programs and policies that address their specific needs. This includes regular consultations, culturally appropriate health services, and incorporating traditional healing practices into public health initiatives. And I ask you, my colleagues, to reflect on your continued action to support Indigenous health equity and self-determination of all Indigenous people. May we have the roll call, please?
Member Ejiofor?
Present.
Member Bauer?
Present.
Member Bradley?
Here.
Member Carr?
Present.
Member Chung?
Present.
Member Dudas? Member Gower?
Here.
Member King?
Here.
Vice Chair DiGiovanni?
Present.
And Chair Kids?
Here.
We have quorum, Madam Chair.
Thank you so much. We have regrets this evening from Member Dudas. Declarations of interest, are there any? Seeing none. Confirmation of minutes of the meeting of January 13th, 2025. Are those confirmed? Thank you. Motion to introduce reports, Member King.
Thank you and good evening. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports entitled Update on Neighborhood Health and Wellness Hubs, Progress and Path Forward, Emergency Management at Ottawa Public Health, Annual Update, and attendance at the Alpha Winter Symposium be received and considered.
Is this item carried? Great, thank you. So on the agenda today, item 7.1, Chair of the Board of Health verbal report. We will hold that. Item 7.2, Medical Officer of Health verbal report will be held as well. Item 7.3, update on neighborhood health and wellness hubs, progress and path forward. We will hold for some introductory remarks. Item 7.4, emergency management at Ottawa Public Health annual update. Is that item carried?
Carried.
Great, thank you. And item 7.5, attendance at the Alpha Winter Symposium. Is this carried? Great, thank you. So we'll return to first item on the agenda, Chair of the Board of Health verbal report. So good evening again, everyone. I would like to extend a warm welcome to all members of the board, the Ottawa Public Health Senior Leadership Team and staff, and our Interim Medical Officer of Health, Dr. Trevor Arneson, who is attending his first board meeting in this role. Trevor, we are very excited to work with you throughout 2025 as we navigate this important year for Ottawa Public Health. I am also pleased to welcome our newly appointed Ottawa Council member, Jessica Bradley. Councillor Bradley represents Ward 10, Gloucester Southgate, and brings a wealth of experience and dedication to our board. I'll note she has particular interest in the areas of affordable housing, public transit, and mental health services. Alors, nous sommes impatients de travailler avec la conseillère Bradley dans ce rôle et de bénéficier de tes idées et de ton expérience alors que nous poursuivrons notre travail pour améliorer la santé et le bien-être de tous les résidents d'Ottawa. Welcome, Jessica. As we look ahead to 2025, I want to update you on a few initiatives. Our selection panel is actively working with Human Resources to hire an executive firm for the recruitment of a permanent medical officer of health. We will keep the board informed as this process progresses. I'm excited to announce new engagement opportunities will be shared with the board later in February. This catalog of engagement sessions includes drop-in program visits, Department 101 sessions, visits to clinics, and partner meetings. And these opportunities will give board members a first-hand look at the incredible programs and work happening at Ottawa Public Health every day. I definitely encourage everyone to participate and see the impact of our efforts touching residents of all ages throughout our city. I'll ask my fellow board members to keep an eye out for these sessions, submit your availability and interest, and take this opportunity to get to know OPH and its incredible team on a new level. Of note, the board is being offered a chance to participate in a blanket exercise with OPH staff. The blanket exercise provides a positive learning experience in helping participants understand how federal government practices and policies affected and continue to impact the lives of Indigenous peoples in Canada. It is an interactive exercise that raises understanding and awareness of the history of the relationship between Indigenous and non-Indigenous peoples. There are a few dates available for this session dependent on participant availability, so please let the board secretary know your availability as soon as possible. A big thank you to those who have already signed up for the Indigenous Cultural Safety Program. For those who haven't, I strongly encourage you to reach out to our board secretary and register. These sessions were developed in response to our 2024 board survey, and we believe they will enhance the comprehensive reports we already receive from staff. Plus tard cette semaine, je participerai au symposium d'hiver d'Alpha avec la vice-présidente Di Giovanni et membre Bauer. Le symposium couvrira les principaux domaines d'intérêt au Conseil de santé d'Ottawa en 2025, notamment l'équité en santé, la santé mentale et le financement de la santé publique. J'ai hâte de rapporter des informations précieuses pour nous aider à guider notre travail cette année. In January, I had the opportunity to attend the Rural Ontario Municipalities Association conference in Toronto, where I represented the Ottawa Board of Health. It was an invaluable opportunity to meet with key provincial leaders, including the Deputy Premier and Minister of Health, the Parliamentary Assistant to the Minister of Municipal Affairs and Housing, and members of provincial parliament from both the Ontario New Democratic Party and the Ontario Liberal Party. I also had the chance to travel to Queen's Park for discussions with officials from the Office of the Premier of Ontario. These were incredibly productive and informative meetings and gave me an opportunity to highlight the good work of this board and of OPH. It also gave me the opportunity to press upon the Minister of Health and Premier's office the importance of a fair funding process for public health units across Ontario as the ministry undertakes its review of public health unit standards and funding, but in particular, the unique pressures facing Ottawa public health. Ottawa, with its rapid population growth, unique and diverse demography, and broad geography, faces challenges that set it apart from other regions. The province has already recognized these differences in initiatives like the Ottawa Deal between the province and the city. We will continue to work to promote their understanding of our uniqueness as we move through the public health funding formula review. I also had the opportunity to highlight in all meetings the importance of the interconnectedness of housing and health, while bringing forward solutions to better bridge these sectors to help improve health outcomes and to reduce pressures on the health system. As we approach the provincial election on February 27th, we know there are concerns shared by all provincial parties, their leaders, and candidates. It is crucial that whichever party forms the next government understands Ottawa Public Health's distinct value and unique challenges and commits to a fair, sustainable funding agreement for our public health unit. Finally, I want to acknowledge Black History Month and its importance in recognizing the contributions and experiences of Black Canadians. The Ottawa Board of Health remains steadfast in its commitment to addressing health inequities impacting Black communities, particularly in the City of Ottawa. During our term, we as a board have worked with Ottawa Public Health staff to implement policies and programs that prioritize health equity, including our anti-racism and anti-oppression workplace policy, and we continue to advocate for inclusive healthcare practices for all. As we recognize this special month, our focus is on ensuring that our work and our policies reflect the diverse needs of the community we serve, while we work together with the community to promote and protect the health and well-being of all people in Ottawa. Plus tard cette semaine, le secrétaire du Conseil de la Santé partagera une liste d'activités auxquelles les membres du Conseil peuvent participer pour reconnaître le mois de l'histoire des Noirs et j'encourage les membres du Conseil à y participer. En continuant de défendre ces valeurs, nous nous enfonçons de bâtir un Ottawa plus sain et plus inclusif pour tous. This concludes my verbal report. I would be happy to answer any questions. Seeing none, is this item carried? Great, thank you. We will move on to item 7.2, Medical Officer of Health Verbal Report. Over to you, Dr. Arneson.
Thanks. Good evening, everyone. I'm very happy to be here tonight for my first board meeting as the Interim Medical Officer of Health for the City of Ottawa. I want to express my gratitude to the board for their trust and to our incredible team at Ottawa Public Health for their continued dedication in pursuing our mission. Ensemble, nous nous engagions à favoriser le progrès vers l'amélioration de la santé et du bien-être de toutes les personnes et de tous les lieux à Ottawa. As we dive into 2025, we continue to be guided by the Ontario Public Health Standards, but also our strategy, which lays a strong groundwork for our direction and includes our organizational commitments that shape how we approach our work. So much of what we do at Ottawa Public Health is dependent on strong relationships and collaboration with the community, and particularly the City of Ottawa. We head into 2025 with a strong track record of partnership that I look forward to continuing. I'm excited to work with all of you to achieve our goals and build a healthier Ottawa, and looking forward to sitting around this table with you all. Over the last year, we've remained committed to helping children and youth get and stay up to date on routine childhood immunizations. In 2024, our neighborhood health and wellness hubs and community clinics have administered over 23,000 routine immunizations to children and youth. We continue to work closely with the Kids Come First Health Team and other local partners, and through our neighborhood health and wellness hubs to offer routine childhood vaccine appointments for those who do not have timely access to a primary care provider. Launched in May 2024, our virtual immunization hub has helped guide many families with information on vaccines and where to access them by providing timely, personalized responses. This past fall, we assessed the immunization records of 7 and 17-year-olds to ensure they had the routine childhood immunizations required to attend school under the Immunization of School Pupils Act. OPH mailed approximately 11,000 notice of incomplete immunization letters to individuals whose records showed they were missing one or more immunizations, and to promote resources to get up to date. OPH is actively working with community partners, including school boards, to encourage parents to update their child's immunization record. In some cases, suspension notices may be provided if necessary and in compliance with the Immunization of School Pupils Act. Suspension notices have proven as an effective method to promote compliance with ISPA and ultimately to prevent vaccine-preventable disease outbreaks such as measles, which is again a recent concern with cases reported in Ontario. Before suspension notices are sent, OPH works to encourage compliance and promote opportunities to access routine immunizations in the community. Je suis encouragé par le fait qu'à Ottawa, avec le soutien de notre communauté, nous avons une historique de forte couverture vaccinale et nous continuerons de faire progresser ce travail important. En ce qui concerne les virus respiratoires, comme prévu, nous avons constaté une augmentation des maladies respiratoires dans notre communauté pendant les vacances de décembre et en janvier. Actuellement, l'activité de COVID-19 est modérée, l'activité de la grippe est très élevée et l'activité du VRS est élevée. Ces tendances à Ottawa reflètent celles observées dans toute la province. OPH continues to provide weekly snapshots of respiratory illness activity in Ottawa across its social media channels to help the public make informed decisions about using their layers of protection, staying home when sick, and staying up to date on their vaccines. Additionally, OPH continues to work with long-term care homes, retirement homes, and congregate settings to encourage vaccination among older adults, particularly those over 80 years of age who are at the highest risk of severe outcomes. We also work to support settings experiencing outbreaks to help reduce the spread and impact of respiratory illnesses. This year's influenza season in Ottawa started in early January, and we are currently in the peak period of influenza activity and was what is proving to be a very busy flu season. The flu vaccination program has been underway since the fall, with most flu vaccines administered through pharmacies and community health care providers. Up to the end of January, OPH distributed over 156,000 doses to community healthcare providers, and pharmacies received over 227,000 doses from the province. In terms of COVID-19 vaccinations, since October 1st, 2024, approximately 18% of the population and just over 50% of adults 65 years of age and older in Ottawa have received a dose of COVID-19 vaccine. This season saw the introduction of a new RSV immunization program, which greatly expanded vaccination for infants and high-risk children. OPH has distributed approximately 8,200 doses of this vaccine for infants and high-risk children and administered hundreds of doses directly in partnership with the Kids Come First health team. Older adults continue to be impacted by RSV, and OPH again supported the vaccination program for high-risk older adults, which focuses on those residing in long-term care and retirement homes. We continue to actively share information to keep residents up to date on respiratory illnesses and to promote prevention strategies, in particular vaccination. Our OPH team updates the respiratory dashboard every Thursday with information on respiratory illness activity. Our website and social media accounts include regular updates on respiratory activity, vaccination reminders, information on symptoms, reducing the spread of illness, and where to seek care. I would also like to take a moment this evening to highlight the significance of Black History Month in the City of Ottawa. This observance is not only a time to celebrate the rich cultural heritage and achievements of Black Canadians, but also an opportunity to reflect on the ongoing challenges faced by Black communities. Recognizing Black History Month is crucial in our collective efforts to continuously improve how we address systemic inequities and promote equity and justice within our society. Ottawa Public Health is deeply committed to advancing the health and well-being of Black communities in our city. We've established partnerships with organizations such as the Interdisciplinary Centre for Black Health and CADHO, Canadian of African Descent Health Organization, to address health disparities and provide culturally relevant services. Our initiatives include the creation of neighborhood health and wellness hubs, which we described in the report shared with you in advance of this evening's meeting, highlighting the range of services offered from vaccinations to mental health support, specifically tailored to meet the needs of Black residents. L'examen et l'amélioration de nos politiques internes font partie intégrante de ce travail, tout en renforçant les connaissances internes, les capacités et les ressources nécessaires pour planifier des programmes efficaces et des relations communautaires réciproques avec les communautés noires d'Ottawa. Looking ahead, we remain dedicated to continuing our efforts to reduce health inequities through targeted programs and community engagement. We will focus on enhancing access to healthcare, promoting mental health, and addressing chronic diseases prevalent in Black communities. By working collaboratively with their partners and the community, we aim to create a healthier, more equitable future for all residents of Ottawa. Thank you.
Great. Thank you so much. Do we have any questions for Dr. Arneson? Not seeing any hands. So is this item carried? Great. Thank you, everyone. So item 7.3, update on neighborhood health and wellness hubs, progress and path forward. We will, of course, open it up for any questions, but I know Dr. Arneson wanted to provide a couple introductory remarks.
Thanks again. So thank you, Chair Kitts. I wanted to take a moment to quickly chat about some of the information shared in the Neighborhood Health and Wellness Hubs report. As this report not only highlights the significant strides we've made in reducing barriers to public health services and optimizing health outcomes for residents of Ottawa, but also invites your valuable insights and questions as the board. The Neighborhood Health and Wellness Hub model, which began as a response to gaps in vaccine access during the COVID-19 pandemic, has grown into a comprehensive framework for delivering essential public health and social services directly within our communities. By strategically locating these hubs in high-needs areas, Ottawa Public Health has worked with partners to provide a variety of critical services such as immunizations, dental screenings, and parenting support, promoting equitable access for all. You'll note that within the report, we look ahead to our plans for maintaining, sustaining, and enhancing these services to continue meeting community health needs effectively And at this time, I invite your feedback and questions and ask you to share your perspectives with any questions you may have. Your input is invaluable in guiding our path forward.
Great, thank you. Member King.
Thank you so much, Chair, and I really do want to congratulate our public health unit for the establishment and the current operation of the neighborhood health and wellness hubs. Firstly, I can say without a doubt that they address health equity by bringing essential services to communities that face barriers to access. I think of my own ward, where I've actually seen it in action. About a year ago, I was going for all my immunizations and vaccinations at the center, and I had to come back on a weekend because it was so busy. And I told your predecessor, Dr. Etches, I was really impressed because many of the people who were coming were newcomers, ensuring that their babies and their young ones were being immunized. So I think that the hubs are doing excellent work. I just noted in the report that given that the report itself identified gaps in mental health support services and primary health care, what specific partnerships are potentially being pursued to address these types of critical needs?
Thanks for the question and for the comments about your experience. Yeah, so mental health and substance use issues, as this board knows, have been a primary focus of the organization for many years and are embedded in our strategic plan. In terms of one of our goals, goal 3 is focused around mental health and substance use supports in our community. So. The partnerships that we're going to be leveraging are the same partnerships that we use in that work in addressing the opioid crisis. Community health center partnerships are critical, and I think really what we've learned from this hubs report and the evaluation is the value of these partnerships. These hubs started as a immunization point for COVID-19 to address some of the equity access gaps, and now the partnerships have expanded to include other areas. And one of these that we're looking to is leverage the work of the teams that work on community mental health and wellness to be more integrated into the hubs and to offer the services to connect to service providers for mental health and addictions. Yeah, so those are so I mean that it's really, you know, the partnerships already exist. It's more about how we leverage them, seeing the need in the community, and that you know, the inequities are exist as you pointed out in many areas of health and healthcare access. So that's why that was highlighted in the report.
I appreciate that. I really appreciate the fact that the hubs demonstrate impressive efficiency through service integration. And I think of one of the locations being in the Rideau Community Hub, which has 40 other service providers. And the idea that those service providers, if they see health issues, mental health issues, being able to direct people to the neighborhood health and wellness hub that resides in that location would be very powerful. So I'm just pleased that there's the identification of gaps. You know, my recommendation would be examining ways that we can close those gaps and provide more services through the hubs. I only have one last question, and it really pertains to the usefulness of the hub, the fact that it represents a proactive approach to public health. Instead of waiting for health issues to escalate, we're providing preventative services where people live. potentially reducing the burden on our healthcare system, which is another reason why I think our public health units in the province should get more money to really assist with that. But I think the report also highlighted the need for improved community awareness. And so I'm just curious, what specific outreach strategies might you be examining or developing to better promote hub services to community members?
Yeah, so that's an excellent question. So I think we continually are re-examining the the way we're connecting with the community. We have a community engagement team that works very hard to get feedback from the community about what the needs are, and that informs the work around the hubs. I'll ask Hindia, who's the lead on our HEDI team, Health Equity Diversity Inclusion team, if she wanted to add any specific strategies that they're looking at right now.
Thank you, Trevor. Good evening, everyone. We are increasing community engagement attached to the service planning to be delivered at the hubs. We are embedded in the community and are constantly and proactively doing needs assessment. We are also looking at feedback loop from population health data, from program data, to be aware of what the neighborhoods are experiencing, barriers to access, and what needs there might be. So we're combining community engagement work and data to constantly plan proactively for how we can strengthen the service range available within the hubs and the service capacities offered within the neighborhood hubs. So this is really important for us, community engagement and being in touch proactively with the needs of the residents of the neighborhoods where hubs are operating is a constant effort at the Ottawa Public Health.
Well, I appreciate those answers and I appreciate the effort. I think that it's a wonderful service. I feel that we should see its expansion, especially in low-income prevalent neighborhoods that require these types of services. And even without, or even with identifying the need to do more outreach, from my experience, seeing the hubs in action, I know that people are seeking them out and people are utilizing them. So I really want to thank public health for all the work that they endeavor and they undertake with the hubs. Thank you so much. Thank you, Chair.
Thank you, Member King. Member Bauer.
Thank you, Chair, and thank you, Dr. Arneson and staff for the report. Very much appreciated the update. It struck me that there's further analysis to be done on gaps in coverage by geographic area, by constituency, and perhaps by vulnerable population in terms of a vision beyond the 10 existing hubs. I've just wondered, however, sort of in your perspective or in a staff's perspective at the moment, where you see the sort of pressing gaps by geography or by population at the moment. And I have a second question as well.
Thanks for that. Yeah, it's always a continual challenge to assess exactly, where the priorities are, and geographically, we've done a fair bit of analysis through our EPI team and others since, and that's really what the foundation was of these hubs initially, was the epidemiologic analysis and the community engagement work to find out where we were seeing gaps in access. And actually, that work even started before we had a COVID vaccine. We started that noticing, the supports were lacking in certain areas for testing and for other support services. that was when this work began, and has really, it's not a random selection of sites at all. A lot of work goes into thoughtful consideration of where. I think one of the big challenges and what we're seeing of why some of these neighborhoods are more disadvantaged is larger numbers of newcomers coming from outside of the country. It's very difficult to navigate the healthcare system, as you likely are aware. And for newcomers coming from a different system, perhaps there's language barriers, and it's often very difficult to access health and social services in a meaningful way. So that's where this connection to immunization has been really helpful for those populations. I think that is reflected in often the neighborhoods we've chosen. And then there's always continual reevaluation of the areas. Like many things, where we would like to be is probably, beyond the resources we have for this. There's definitely considerations of different types of disadvantage. We've considered the impacts of rural areas and access to certain services. And you've rightly mentioned that there's other disadvantaged groups for other reasons, which may not be geographically in one area, and how can we direct them? And we've applied some of these principles to other areas, not just the health hubs. So it's a continual process of reevaluating, and over years, the makeup of different neighborhoods and the city shifts as well. So we have to be conscious of that.
Thank you. My second question really builds upon Councillor King's second question, which some of us on the board had an opportunity to visit one of the health hubs last year in an engagement session. So it was a very insightful visit to the range of services. It struck me then, and it strikes me even more now, that mental health and substance use navigation supports were perhaps sort of a gap crying out for attention in terms of our city's response to the current crisis. And so I would just support Councillor King's intervention just now in terms of looking at that, given the establishment of heart hubs by the province, given the establishment or the stresses on our community health centers and our other community providers. So I'll defer the question to just an encouraging comment for staff to sort of go down that path.
Yeah, and I was just thinking about my response earlier. It has been a consideration from when the very early days of looking at other services and what the community need is, and certainly we have had mental health supports in the sense of helping people be directed or navigated from the beginning of sort of the expanded service offerings. I think the challenge, when you have such a wonderful array of services, is you also have, not everyone needs the same services, or maybe it's their families or others. And so it's still about, what's bringing them to the site, and then what services or how to direct people in the right way. So it's a good point that we need to think a little bit more about, perhaps people most in need of mental health and substance use navigation and support are not going to readily show up at these sites. And that's really, I think, where the gap is in terms of engaging the community and making them aware of what's available.
Great, thank you.
Thank you so much. Member Gower.
Thanks. In terms of the locations where these hubs are, I've been to a couple of them. I think when this program started, it was a combination of storefront retail locations, also some city facilities or partner facilities. But in general, is that still the approach? And have there been any issues with obtaining space or access to space?
I think space has been an interesting consideration over the lifespan of the hubs because they started in a pandemic and a lot of things that were being used in recreational cultural facilities might not have been happening when they started, right? So initially, space was not really a big concern, I don't think, for the team. But then, as things have opened up and we want to support the use of library spaces and community centers for cultural and recreational activities, and there've been a lot of negotiations that have happened around the spaces, and whether there's one space that's closer to another that could be combined, and a lot of ongoing monitoring around what's the what are the sites that are seeing the most visits and are being used extensively. Maybe I'll ask India again if she has any thoughts on recent considerations around space, if there's any thinking going on about where that's going this year or in the near future.
Thank you, Trevor. To be truthful, space is part of the challenges that we intend to address in our enhancement plans. The demand is increasing given our efforts to increase awareness and promote accessibility. So we're seeing greater demand, and some of the hubs are pressured with regards to space. Our intention is to help resolve that with using partnerships and building capacity for the adequacy of the spaces of the hubs based on the population demanding or requesting services. So this is an ongoing work for us, and we will continue to pay attention to the adequacy of the spaces available given the number of people coming to seek services.
Okay, well, it'll be interesting to see how this evolves over the next couple of years, and maybe a model for other city departments to follow, how to get out there to where people need the services rather than telling people to come to us, getting out there. Thanks.
Thank you, Member Gower. Vice Chair DiGiovanni.
Good evening, and thanks for this report. Yeah, so I won't echo what my colleagues have said. I am a big fan of the health hubs. I do feel like it's a bit of a silver lining that came out of COVID that has really has the opportunity to really drive what we stand for in terms of lowering the barriers and making our services accessible. Things like the dental screening, that's not just the dental screening, but also support so that families have access to dental programs that then they can follow up. It is those types of things that just make it easier for families, and I think that's really key. So 2 questions. I really appreciate the comment on the community engagement work and responding to the needs of the neighborhood. I don't think any of the health hubs can be cookie cutter. I think they really do need to be driven by the needs of the neighborhood. And so we'll see that coming out, I'm sure, as it moves forward. So it's actually building on comments of my colleagues. So Member King talked about the value of partnerships and that synergy. I think you mentioned, Member King, that the health hub in your riding actually has, it's a bit of a conglomerate of 40 different community partners. And so there is a synergy there in helping families navigate their way. So my first question was, how many of the hubs at this point are set up in that manner so that they're, not just Ottawa Public Health, but actually other community service agencies that are co-located. And then, picking up on what Member Gower had just said, I do think it's an opportunity to be, using these hubs, if we've used our epidemiological data to make sure that they're in the most vulnerable neighborhoods, is that an opportunity for the city to then be hooking on services around that would be of added value? So maybe if you could comment on both of those aspects, Dr. Arneson.
Yeah, I'll respond to the second one first, because I think that's really highlights a key part of what is making these locations, these neighborhood health and wellness hubs so effective is the partnership. So as described in the report, there's, it's not just public health services, but also social services through our partners within the city, community social services department, that we're seeing opportunities. And yeah, I think a lot of, it's a good point that you made. It's not so much necessarily that people are looking for a specific service like a needle in the arm, but it's actually, understanding this complicated health and social service system that we have, and where they can go for support. In terms of, so we've been trying to build the model to be across all of the sites, to be more than simply an immunization hub, to have these other partnerships that deliver the services. And you'll see in the report, there's even some around cancer screening with the Ottawa Hospital, Champlain region work, and diabetes screening has happened. And so those aren't necessarily specific to locations, as I understand, but more of an approach to try to bring those partnerships across hubs. But I'll let Hindia speak to whether there's any specific, are there any specific numbers of hubs that provide certain services, or is it generally that you try to have all of the hub locations offering these types of partnership services?
About half of the hubs have services delivered through partnerships with city departments, and most hubs are operating through partnerships. So it's a big part of the strategy is that public health services are co-located with other health and social services. So it's a central kind of strategy, that of proactively seeking partners to bring services to respond to the needs of those neighborhoods.
Yeah, so it is like, we're not looking at it as specific in numbers. It's about half right now, but yeah, the general sort of approach and is to make that part of the foundation of all the hubs.
Any other questions, Vice Chair?
No, thank you. Sorry for that. Thank you.
Okay, thank you. Member Chung.
Thank you, Chair Kitts. I was just wondering, I noticed in the report there was quite a range of gaps identified, and one of them was primary care services. Just wondering if there were any details on the types of primary care services that were noted as gaps. And the second part of my question is, what role does OPH envision itself as in filling that gap? In the recent engagement session, we heard about the interrelationship between public health and primary care services, but we have to, be careful in not filling that gap completely. So I was just wondering about that.
Yeah, no, it's a great question, and something that I myself and the senior leadership team think a lot about and talk a lot about. I mean, certainly these hubs are meant on providing public health services that we traditionally provide closer to the community, and then this partnership work is really where we've found an extra way to support the community in some of the healthcare service gaps that are being seen. I think it's not just at neighborhood health and wellness hubs where we're hearing about concerns about primary care. I think everybody's hearing about it everywhere. And really the concerns are probably similar of what we hear, which is, people don't have a family doctor or nurse practitioner that they can regularly go see. It's important to note that these hubs do not have nurse practitioners or family doctors, so there's many services that only those primary care providers can provide. And there aren't plans to specifically, expand these into primary care clinics that would have those types of professionals working in them. But we're open to, exploring ways that public health can support, the primary care system to enable people to have those services that they're looking for. And also, I mean, we can be a channel for information. We can be a channel for coordination by working with the community partners. And maybe, there will be opportunities for space sharing or co-location down the road at some point. But certainly, it's good to identify that, we are hearing a lot of concerns about gaps in primary care access through this channel, like we are through our community engagement and many other channels. But we're not seeking to fill those gaps with these neighborhood health and wellness hubs directly.
Thank you.
Thanks very much. Member Bradley.
Thanks very much, Chair. Like my colleagues have said, many of us appreciate the health hubs. Unfortunately, I had one of my primary health hubs at the Greenboro Library closed just last month because the library needed to reclaim their space for service delivery. Fortunately, we have another health hub close by at a local mosque that's been serving the community. I know there hasn't been a lot of major complaints to public health directly about the loss at the Greenboro Library, but certainly because my ward office is in the community center there, we hear it from people that they're disappointed as they find out because they've now kind of been used to going to get their vaccines and such at that location. So just touching on space again, because I heard Hindia say that it has been a challenge. Are there any other health hubs that have been closed down recently or any other at risk that you know of? And are we proactively looking for new locations in areas that may be at risk?
Yeah, I'll let Hindia speak to it, but I mean, just to say in advance of that Hindia has thankfully joined us in the past a couple of months, and it's wonderful that she's with us. But I mean, this has been a continual conversation since the start of the hubs, and as I mentioned earlier, it was particularly difficult when a lot of community programming was needed in the spaces that we were using. But in terms of the recent what's going on with this space, and if there's been any others, Hindia, can you provide any further elaboration?
Thank you, Trevor. Councillor, I'm not aware of recent closures of other hubs other than the Greenboro hub, but I can look into that and provide the information to the council.
Yeah, I think that would be wise just to get a sense of how many of our locations potentially are at risk as facilities are looking to reclaim them because they are quite popular. And I guess what type of data is public health currently collecting on how many people are visiting the sites, what services they're using? Is there any requests for additional services that the community might want to see just to get a sense so that, because I know when Greenboro was closing, I didn't get a sense exactly of how many people were coming daily, monthly, et cetera, in order to understand the impact in the community, which would have been helpful. So just wondering what type of data is being collected at health hubs.
Yeah, so we are collecting that data in terms of visits and reasons for visits. Hindi, do you have any specifics on what currently?
Yes, Trevor, thank you. Yes, we are collecting program data, and we are improving our capacity to ensure that this data is collected for all programs at OPH, including the programs offered at the hubs. So it's in development, and it's a growth path for us. But that's certainly a priority for us so that we have the feedback loop with regards to service demand and access. But we are also collecting population data with regards to the neighborhoods, so we can understand what are the primary needs of these, or health status and primary needs of residents of these neighborhoods. And finally, we have a very proactive community engagement work. Our staff is embedded in residents in these neighborhoods and are constantly talking and collecting information about what the needs might be. So all these feeds into our service planning, and we are continually building capacity with regards to our ability to make that consistent across all programs with regards to collecting this data.
Great, thank you.
Thank you, Member Bradley. Member Carr.
Yeah, I was just going to say, I know we lost Heron Road Health Wellness Hub about 2 years ago when it reopened for a shelter, but it's supposed to, the shelter should be gone in the next few months. So hopefully we're going to be reopening that. Because that is not exactly in the same geographic area as Councillor Bradley, but it is very close. So anyhow.
Is it a comment, question?
So yeah, in terms of that specific site, yeah, it was probably again around the time when different facilities were looking for space. So yeah, I mean we are looking at the constantly looking at different options, and I think what we're hearing here tonight too is we have to look if potentially there's some partnerships that would enable us to have spaces and relook at it. But we have been continually looking at at where they're located and what the most disadvantaged areas are. And yeah, it's when you have a successful initiative like this, it creates a situation where you want to have them located in more places, but at the same time, we have to do with what resources we have. Not sure if there was any other specific addition you had, India, about that. I mean, we are looking at the Heron Road is. It was Heron Road you said, or?
Yeah, we had a hub there and then it had to shut down in November of 2023.
Okay.
Hopeful we'll have that one because it's been a lot. Our community sort of share.
Yeah. So certainly, those areas in the south end of Ottawa have been identified as areas that certainly need these types of supports and have been a focus of many of our efforts since the hub started in the pandemic and even before.
Perhaps we can get follow up for Member Carr after about the status of Heron Road and what if it will transition back. Great, thank you. I'm not seeing any other hands. I'll just offer a comment. Thanks everyone for the great discussion. I think it has been really great to see the health and wellness hubs evolve since initially they were stood up for COVID. I think I agree with the vice chair, definitely a silver lining that this was a successful model to deliver services to priority neighborhoods. So credit to the team for growing the offerings to respond to changing needs in our communities. And the success of this model is something that I have brought forward in my discussions with the province. Minister Parsa, the Minister of Children, Community and Social Services, had shown an interest. We were grateful to host him for a visit last year at one of our hubs. And then we did subsequently get an increase in funding to one of the programs, the Healthy Babies, Healthy Children, which is one of the offerings at the hub. So I think it definitely is recognition of the success of the model, and we'll continue to look for opportunities to expand and continue to support. So thanks to the team for the report and for the great great work you're doing in our communities through those hubs. With that, is this item carried? Great, thank you. In-camera items, we have none. Motion to adopt reports, Member King.
Thank you, Chair. Be it resolved that the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, and the reports titled Update on Neighborhood Health and Wellness Hubs, Progress and Path Forward, Emergency Management at Ottawa Public Health Annual Update, and the attendance at the Alpha Winter Symposium be received and adopted.
Is that carried? Great, thank you. Don't believe we have any motions requiring suspension of the rules. Do we have any notices of motion? Seeing none, confirmation bylaw, Member King.
Be it resolved that confirmation bylaw number 2025-2, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of February 10th, 2025, be read and passed.
Is that carried? Thank you. Do we have any inquiries? Seeing none, just before we adjourn, please join me in wishing our board secretary a very happy birthday. She will be celebrating her birthday tomorrow. I thought it was tonight and I was going to make everyone sing, but it's tomorrow. Happy birthday, Casey. And with that, we are adjourned. Thank you.